Hey guys, Dr. Seigel, UroCoach. There's a lot of hype around low intensity shockwave therapy and Gainswave therapy for ED, erectile dysfunction. Watch this video and we'll talk about it, see if you're a candidate for it. And at the end, I'm going to give you my parting shot so you can figure out whether you should do this therapy or not. All right, so let's get right into it. But first, like, subscribe, comment. We want to hear what you guys want us to talk about. All right. So low intensity shockwave therapy for erectile dysfunction, or Gainswave therapy, they apply a probe to the side of the penis. This induces inflammation in the penis, and this inflammation in turn causes blood vessel growth by inducing growth factors to come into the penis. All right, that's one mechanism of action for it to work. The second is that it's postulated that microplaques in the penile tissue in the blood vessels will break down and stimulate blood flow. If you think about erectile dysfunction as primarily a problem with blood flow in, this makes a lot of sense. Now, what is a typical protocol? A typical protocol is initially 6 treatments, either once a week for 6 weeks or twice a week for 3 weeks. And then we see, does this help somebody or not? If it does, then we can consider doing treatments for the next year that are sometimes every other month. How are these treatments done? So typically with Gainswave therapy, a numbing cream is applied to the side of the penis, and then the session is about 15 to 20 minutes. For other kinds of low intensity shockwave therapy, you don't always have to apply a numbing cream. Guys want to know if it hurts. Usually does not hurt, just feels like a tapping sensation. So then the question everybody wants to know is, does it work? Should I do it? So the initial studies that were done for linear or focused low intensity shockwave therapy, and they reported a 60 to 70% improvement, meaning 60 to 70% of guys responded. They reported an improvement in their erectile function. But you got to remember, this was for focused linear intensity shockwave therapy. Gainswave is actually different. It's a radial therapy, so it's less focused. It doesn't have an energy spike and then a refractory period. Having said that, I don't want to tell you guys that Gainswave therapy won't work for you. There's a really popular study that was done by the Taylor and Francis group where they took 20 guys and they gave them radial therapy like Gainswave, and they took 20 guys and they gave them linear therapy, and they actually found that the Gainswave therapy or the radial therapy group got a better benefit from the shockwave therapy to the side of the penis. 13 out of 20 of those guys actually had an improvement in their erectile function. I guess my take on it is that linear therapy is probably better, but the reality of it is that most of the centers in the United States have radial therapy like Gainswave, and this is kind of my pearl of wisdom. The most important thing that you need to ask yourself is, do you get some erectile function with or without medications? If you do, then it's worth considering these therapies. If you don't, these therapies probably aren't going to help you. Why is that important? It's not so much a side effect thing. These really don't have any side effects, low intensity shockwave therapy, but it's your time and your money, right? You're driving into the office, you're having to get the treatment, 15 to 20 minutes, parking, applying the numbing cream. That whole rigmarole is pretty time intensive. The other part of it is that the cost. These therapies aren't covered by insurance. So we're talking about sometimes $500 a treatment. That's the typical cost of this therapy. So you want to know in advance whether you're going to get some kind of benefit from it, if at all possible. Anyway, guys, I hope that's helpful to you in trying to figure out whether Gainswave therapy or low intensity shockwave therapy is for you, the way it works, etc. Thank you so much for listening. We certainly appreciate it. Please like, subscribe, comment. We want to hear what you want us to talk about. Have a great day.